Autism spectrum disorder is a neurological and developmental disorder that begins early in childhood and lasts throughout a person's life. It affects how a person acts and interacts with others, communicates, and learns. The cause of ASD are not known. Researchers suggest that both genes and environment play an important role into children that are diagnosed with autism. Um, it's called a spectrum disorder because people with ASD can have a range of symptoms. People with ASD might have problems talking with you, or they may not look you in the eye when you talk to them. They might also have restricted interests and repetitive behaviors, and they also tend to spend a lot of time putting things in order, or they may be repetitive in the way they speak. So they might say the same sentence over and over again. There's that. So next we'll go into diagnosis, how children um, are diagnosed and the whole process of that. So autism spectrum disorder varies widely in symptoms and severity, making the diagnosis pretty difficult. There isn't a specific medical test to determine the disorder. When parents take their children to their daily checkups, doctors will look for signs of developmental delays. And if the child shows any symptoms of the disorder, the parent and child will likely be referred to a specialist who treats children with autism, such as a child psychiatrist or psychologist, a pediatric neurologist, or a developmental pediatrician. And those are all different types of specialists that are known to help evaluate. Um, Things that the doctor will look for, they will observe your child's social interactions and communication skills. There will be a variety of tests that will be given, such as a hearing, a speech, a language, and social and behavior um, tests that will be done. And they also use a criteria in the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, that was published by the American Psychiatric Association. They kind of follow those guidelines as well to go get further into the process of diagnosing your child. Um, Other disorders and non-disorders that correspond with autism spectrum disorder are these that are shown here. We have ADD, ODD, specific learning difficulties, ADHD, anxiety, Tourette's, OCD, development delays, sensory integration disorder, auditory processing, and depression. So this is kind of just other um, mental disorders that can correspond with autism spectrum disorder. Signs of autism spectrum disorder in early infancy includes reduced eye contact, lack of response to their name, or indifference to caregivers. Um, Children that are a little bit older may develop normally for the first few years of life, but then suddenly they may become withdrawn or aggressive or lose language skills they have already acquired, and signs usually are seen by 2 years old. Each child with autism spectrum disorder is likely to have a unique pattern of behavior and level of severity, ranging from low functioning to high functioning. And areas of delay are seen in social communication and interaction, and with patterns of behavior. And when it comes to social communication and interaction, things that you will see is with children with autism, they fail to respond to their name or appear not to hear you at times. They also resist in cuddling and holding and prefer to play alone. They also have poor eye contact and they lack facial expression, and they usually don't speak or have delayed speech, or they can also lose previous ability that they had to say words or sentences. And those are just a few of the symptoms in social communication and interaction, um, out of many other symptoms that fall into that category. As for patterns of behavior, things that you will see in children with autism, they don't usually engage in imaginative play or make believe. They usually perform repetitive movements such as rocking, spinning, or hand flapping. Um, they usually develop specific routines of rituals and become disturbed at the slightest change. And as well as they also fixate on objects or activities with an abnormal intensity or focus. So, when it comes to autism spectrum disorder, um, according to the DMS-5, um, autism has actually been categorized into 3 levels. So the first level would be requiring support, the second level being requiring substantial support, and the third level requiring very substantial support. So for level 1, the one requiring probably the most minimal amount, probably in a, it's probably on the lower end of the spectrum. Um, so with kids who are on the functioning of ASD level 1, um, they usually have difficulty initiating social interactions, and clear examples of atypical or unsuccessful responses to others. And they also may appear to have decreased interest in social interactions. For example, a person who is able to speak in full sentences and engages in communication, but whose to and from conversation with other fails, um, that's something that can tend to be kind of odd and typically unsuccessful. Um, Also, they also have difficulty switching between activities, and they have problems with organization and planning independence. And for level 2, requiring substantial support, deficits are seen in verbal and nonverbal social communication skills. Social impairments um, are apparent even with support in place. Usually, children in this level are limited to initiation in social interactions and um, have reduced or abnormal responses to social overtures from others. For example, a person who speaks in simple sentences, whose interaction is limited to narrow special interests, and who has markedly odd nonverbal communication. And as for level 3, which would probably be the most severe level of ASD, would be requiring very substantial support. Here you see severe deficits in verbal and nonverbal social communication skills, which cause severe impairments in functioning. Children are also very limited in initiation of social interactions, and they have minimal response to social overtures from others. For example, a person with few words of intelligible speech who rarely initiates interaction, um, and when he or she does, they usually make approaches to meet needs only and respond only to very direct social approaches. Okay. Next here, I am actually going to play you a video of my son who is actually on the spectrum. In this video here, you will see that his verbal communication is minimal, but he does get through it, as well as eye, limited eye contact and some type of um, stereotypy, or in other words, hand flapping.
Good job, Papa. High five. High five.
Okay, so that was that. That was just a little clip of my son. He is actually 6 years old right now, so you can see the severity of his condition. Next, we will go into treatments and specialists that are available for children on the spectrum. There are many ways to help minimize the symptoms and maximize abilities. People and children who have ASD have the best chance of using all of their abilities and skills if they receive the appropriate therapies and interventions. The most effective therapies and interventions are often different for each person. However, most people with ASD respond best to highly structured and specialized programs. And in some cases, treatment can help people with autism to function at near normal levels. Um, Research has shown that early diagnosis and interventions, such as during preschool or before, are more likely to have major positive effects on symptoms and later skills. So, some type of treatments and specialists that children on the spectrum participate in would be occupational therapists, and those are the ones that help improve daily living and work skills of patients. Um, there's also the clinical psychologist, and that is someone who helps treat mental disorders such as autism. Um, there's also neurologists who treat nervous system disorders, which autism spectrum disorder is a nervous system disorder. There's also a psychiatrist for those on the spectrum who may also be dual diagnosed with something else and may need to take medications and meet with a psychiatrist. And then, of course, there's the daily the pediatrician, your normal doctor that you go to for your checkups. Um, and then there's also the speech therapist that helps children with speech and language problems. And lastly, here, I actually had the chance to interview someone who is on the spectrum. He is actually high functioning. So I just asked him a few questions about his experience in school and work experience, and um, his independence in his home life. So here is this.
Okay, so growing up, did you go to public school or private school?
Mostly private, but both.
Okay, so which one did you like better?
Private.
Why?
More individual attention, easier to make friends, and it was easier for me to learn in a smaller classroom setting.
Okay. Well, what went wrong when you went to public school?
Not as much individual attention, so it was hard for the teachers to cater to my basic needs. Not everybody learns the same way.